Are you fed up, tired, overwhelmed of paying high prices for prescription drugs? If you are, then you want to stay tuned to this show because there's some real news that you can use. Hello, and welcome to another edition of Real Possibilities. I am absolutely so excited about the broadcast for today. We have one of the most important topics that AARP has been dealing with over the last 10, 20 years, and that's prescription drug prices. And to talk about the lowering of prescription drug prices, we have our own AARP, Lee Purvis, with us today. Lee, thank you so much for joining us. We're glad that you're here. How long has AARP, were we on the battlefield? We still are. It's not over, but we've got a major win. But how long have we been talking about lowering prescription drug prices?
Well, to give you a good idea, I started with AARP 21 years ago, and we have been working on it the entire time that I have been at AARP. So definitely a longstanding issue.
And it just goes to show people that, when we fight to win at AARP, that we don't give up, we don't grow weary or tired. We're working on fierce, wise friend, fierce defender for all those 50 and older. And we're going to stay on the battlefield until we get across the finish line. And thank you to all of you who may have sent an email, a letter, or a note, or whatever to your elected officials telling them to lower these daggone prescription drug prices and let Medicare negotiate those prices. So Lee, tell us a little bit about, you said 21 years, that's 2 decades and a year, if my math is correct. Tell us a little about what you do at AARP.
Sure. So my official title is Prescription Drug Policy Principal in AARP's Public Policy Institute. And what that means in practice is that I'm responsible for AARP's policy around prescription drug issues. And that can run a pretty wide range of issues. It can go anywhere from prescription drug pricing to prescription drug coverage to what FDA does in terms of approving drugs. So kind of gives you a good idea of exactly how much work AARP does on this issue.
And for people who may not know, and I think most people do, but what's the significance? Why is this so important to AARP? We have a dedicated person. You are really about prescription drug prices. Why is that so important to the folks that we serve?
I think there are a few reasons. The first one, of course, is the fact that older Americans tend to use more prescription drugs than any other part of the population. On average, they're taking between 4 and 5 per month. And unfortunately, they tend to be very expensive. So we know that there are a lot of people who are having to make those tough decisions between paying for the prescription drugs that they need and paying for other important things like their food or their rent. And that's something we've seen very consistently over the years in our surveys of members. Of course, we're a member-driven organization, and we know that this is something that they want us to be working on, and that is exactly what we've been doing.
Thank you. And so we had a major win. Was it 2 years ago now? And this past January, some part of that win was executed or implemented. Talk a little bit about what happened.
Yeah, so an incredibly important and, in our perspective, historic law passed in 2022 with AARP's extremely strong support. And what it included was a lot of different provisions that are designed to help bring down prescription drug prices and related out-of-pocket costs. So it has really important changes like allowing Medicare to negotiate the prices of prescription drugs and a new out-of-pocket cap for spending for people in Medicare Part D, which covers those prescription drugs you pick up at the pharmacy. There are also penalties for drug companies that increase their prices faster than inflation, and caps on how much you have to pay for insulin. Just a lot of different changes in that law, all of which are really going to help bring down costs for the people that AARP represents.
And so there, in January of 2026, there were some drugs that were capped. And would you share with the audience what those drugs are and what the next steps are?
Absolutely. So starting January 1st, 2026, the first 10 Medicare negotiated drug prices became available, which was a huge win. This is a process that's taken a few years since that law first passed. But what it means in effect is that people are now paying significantly less for some drugs that a lot of people were using. So drugs like Eliquis, drugs like Jardiance are included in the program as well, and Entresto, which treats heart failure. These are drugs that are used to treat conditions that affect a lot of people in the Medicare program. And in terms of what people are paying for them, we've actually taken a look and found that on average, the cost sharing for those drugs is going to be dropping by an average about 50%. Wow. So we know not only are the prices coming down, but the costs that people are paying are coming down as well.
And that's huge. And so people need to, it should be automatic, but people need to make certain that they're aware and check with their pharmacy or check with their primary physician or whatever to let them know that these costs are going down. It should be automatic, but it may not be across the country. Is that correct?
So yes, this is something that'll be available to everyone in Medicare. Those prices will automatically be available. And to be clear, this is just the first round. There are already 30 more drugs that have been selected for prices that will become available over the coming years, and more drugs will be selected over time. So this is something that will progressively get larger and more drugs will be included. So not anything that anyone has to do, but it's really important for people to be aware of it, especially if you happen to be taking one of those drugs that's been selected, because what it means is that a lower price will be coming soon.
And what is also important for people to know, right, is that they were a part of this win. I mean, in terms of just raising their voices, we'd had so many stories at AARP from people. I never will forget the woman who shared with me she had to sell her wedding ring in order to buy her prescription drugs, particularly after her husband had died. And we were sitting there crying together, just listening to the story. People are trying to decide whether to pay their mortgage or their rent, or to buy groceries, or to pay for their drugs, or cutting their drug prescriptions in half, or most prescriptions say you need food, take with food if you don't have the right kind of food. It's a major issue for folks. And so anyone who lifted or raised their voice, or wrote a letter or whatever, this was part of your win. And AARP has been there to be supportive of lowering these prices for quite some time. When you talk about, and we use a term, sometimes we use terms that outside of folks external to AARP aren't aware of. So when we talk about Medicare negotiated prices, what does that mean?
Yes, prescription drug pricing in particular can be pretty complicated. In terms of what these negotiated drug prices mean, it's actually a few different things. So when you're talking about a negotiated price, you can be talking about for people who have not yet met their deductible, that is the price they pay at the pharmacy. For people who have met their deductible and have to pay what is known as coinsurance, which is cost sharing that's based on the drug's price, it's a percentage of the drug's price instead of a flat copay. The negotiated price is the basis for how much they pay. So for example, if the drug's negotiated price is $100 and your coinsurance is 25%, you pay $25. So for both of those situations, what's important about that lower negotiated price is mean that your costs will be less, whether it's before the deductible or after the deductible. That new negotiated price will mean savings for you. And as I mentioned, we've already found that the cost sharing for those first 10 negotiated drugs is falling by an average of about 50%. So it's something that is going to be meaningful for those people that are paying it, whether it's full cost or a share of the cost.
Absolutely. And in the Medicare negotiated drug prices, that's similar. I think I heard that explained, like some of the big box stores, they negotiate their prices. So Medicare, you want to talk a little bit about Medicare negotiated prices and why that was so important as well?
Sure. So what a lot of people may not be aware of is that when Medicare Part D, the program that covers those drugs you pick up at the pharmacy, first started, it was actually prohibited from negotiating drug prices. And so it didn't really have the ability to use its negotiating clout to get prices down. And that's something that we never thought made any sense at AARP, and is why we were pushing so hard for that authority that it finally gained in 2022. So it's really important from the perspective of allowing Medicare to use its bargaining power. And that is why we're now able to see the fact that it does work as expected, and we are seeing those lower prices that people have been hoping and expecting from Medicare having the authority to do the work it's doing now.
So much of this seems like it's common sense. It's one of the things that continues to boggle my mind. Let Medicare negotiate drug prices. Okay, everyone to say okay and join hands and say great job. But it's taken so long, and it's taken a long time to get here, to get that win, as a result of some of the lobbying efforts and big pharma. And for those who may not understand what's involved in terms of the lobbying efforts and the research and development, can you talk a little bit about that and how it impacts or does it even impact the work that we're doing?
It absolutely does. Speaking as someone who's been in this space for a while now, the drug companies do a very good job of pushing back on efforts to try to get those prices down. And that is definitely something that was happening when it comes to Medicare drug price negotiation. The fact that there was a push for close to 20 years to try to give Medicare that authority, and it didn't happen despite such strong significant public support is a good indication of how much negotiating power or how much lobbying power they have in the Washington, D.C. So it was taken as a huge win when Medicare was given that authority, because it took a lot of work from a lot of different groups for a very long time to kind of get it over the finish line.
Lee, one of the stories that always stuck with me was the price of diabetes, medicine for diabetics, and how that over years that medicine hasn't changed, but the price has escalated. Can you talk a little bit about that?
Yeah, unfortunately, that's not limited to just those insulins that you're talking about. What we see every year is that brand name drug prices typically increase, sometimes at pretty substantial rates. And we've actually taken a look at what that looks like over time. And a good example, we took a look at 25 drugs that Medicare spends a lot of money on, and we found that on average, from the time they came on the market to the time today, their prices have increased by an average of 67%, but there are some that have increased by more than 200%. And in the past, we've seen some drugs whose prices have increased over 700% from the time they were approved by FDA. So unfortunately, that is a really common behavior for drugs companies, is to have those brand name prices increase every single year that they're on the market.
Wow, and the medicine doesn't change, and so yeah, the cost they don't escalate that much. I remember some comparison situations where they talked about a loaf of bread, what it costs, and if it increased by like 100% or 150%, we couldn't afford it anymore. So it's very similar to that. What are some common mistakes that people make, or what should they know about their benefits and how to check their benefits? Because particularly older adults, we kind of sometimes get in a pattern of doing the same thing. But what are some tips or things that you would share with them that they need to know about their prescription drugs?
When it comes to your coverage, I think one of the biggest mistakes that we often see is that people don't take the time to look at their plans for the coming year. There can be a lot of differences in terms of what your plans cover, how much you're having to pay for it, your premium. And so it's really important for people not to just stick in that same plan year after year, because the reality is they can change a lot, and it can actually end up costing you a lot of money. Something else that I think it would be helpful for them to get in the habit of doing is talking to their healthcare providers, whether it's your doctor, your pharmacist. A lot of times when people are having a hard time affording or accessing their prescription drugs, they kind of get stuck. And oftentimes there are other options available to them. And that's another thing that's really important for people to do, is stay in constant contact. If you're having a challenge getting the prescription drugs that you need, there is usually some help out there, but you have to reach out and ask for it.
And that's really good advice, because you just keep taking what you're always taking. And the generic versus a brand, are the generics? I know you're not a medical expert, but what's your advice regarding generic versus a brand name?
AARP is extremely, extremely supportive of people switching to those generic and what are also known as biosimilar drugs that are equivalent to those brand name products, because the savings can be really significant and it really will reduce your costs. And it is effectively the same drug. So you can expect the same sort of treatment that you have from the brand name product. So really important to keep an eye out for those new generics and biosimilars when they become available.
And are they really exactly the same for the most part, or should you check with your physician to make certain, or just ask for the generic regardless?
So in some instances, you may be switched automatically depending on your health plan. But if you have any concerns, absolutely talk to your prescriber, the person who prescribed that drug for you. But the Food and Drug Administration does an incredibly good job of ensuring that those drugs, you can switch back and forth between the two without any change. And so it's definitely safe and something that people should consider, especially if they're facing those high costs.
So thank you for that. And so you mentioned earlier that there were about 30 other drugs that are going to be also Medicare negotiated prices and reduction. What's the time frame? I know you can't name all 30 of the drugs, but some of or maybe you probably could, but not in the time that we have left. But what are some of the more, I won't say more common drugs that are on the market? And what's the time frame? How soon will those prices come down?
Yeah, so the negotiation process actually takes 2 years. So for example, in 2025, Medicare selected and later announced the negotiated prices for 15 drugs whose prices will become available in 2027. And then more drugs are selected every year on that same lag. So you'll hear them selected at the beginning of the year. The negotiated prices will be announced by the end of the year. And then January 1st, 2 years after that year of selection, that is when those prices become available. So there's a little bit of a lag between when the drugs are selected and when those negotiated prices become available, but it's nice to know that it's coming. If nothing else, it can help you plan. And in terms of what sort of drugs have been selected, it's actually probably more helpful to think about those conditions that commonly affect older adults. So
Right.
things like diabetes, cardiovascular issues, asthma and chronic obstructive pulmonary disease and autoimmune disorders, and then cancer. So we're seeing a lot of drugs you've probably seen in commercials like Eliquis and Jardiance and Entresto, Ozempic, which is used to treat diabetes and other things these days, Xtandi, which treats cancer, Trulicity, another diabetes drug, Erleada, a cancer drug. So there's a lot of names you probably have seen on TV, heard on the radio. Those are the types of drugs that are being selected for Medicare drug price negotiation because they also are focusing on the drugs that cost the program the most. So they're also the drugs that people are using.
That's great. And that you get people really excited about, what's coming. They can just hold on a little bit or else, check with, like you said, some of the generic options that are out there as well. We talked a lot about lowering the price of prescription drugs, but you're looking at all things related to prescriptions. So what else is on the horizon? Transparency. What else are we looking at?
Yeah, so this is a very broad issue. And one thing that I think is important to point out is that even though that 2022 law that passed was incredibly important and has provided a lot of really important benefits, a lot of those are within the Medicare program. And AARP is very cognizant that we represent everyone age 50 plus. And so we've been very clear about the fact that although we very much appreciate the law, we are going to continue working on this issue until everyone can afford the drugs they need. And so there's a lot of activity ongoing at the state and the federal level that focuses, there are certain buckets. Yes, of course, price transparency is incredibly important. Another really important change that's needed is trying to fix some of the what I like to call shenanigans that take place within the market. There are a lot of things that drug companies can do to extend the amount of time that they have a monopoly when they can charge those high prices before generics become available. And there's a lot of interest in trying to address those types of challenges as well, which will help everyone and help make sure that those generics get on the market faster. So a lot of different things that still need to be done. There is no silver bullet in this space, unfortunately, but AARP is engaging with a lot of them.
I love it. And one of the things that continues to boggle my mind is that other countries sometimes can offer the same drug at such reduced prices. We even had an elected official on our show some time ago who is Alyssa Slotkin, who said that she goes over the border to Canada, used to go over the border to Canada to get her mother's drugs because they were so much cheaper. Why is that?
The short answer is because drug companies can charge higher prices here in the United States. And that is why we tend to pay 3 to 4 times higher prices. There is a lot of interest in trying to bring US prices more in alignment with those international prices. We will see whether those work out, but it's definitely something that I think is striking and speaks to a fairness question. Because they are the exact same products and there is no justification for the US paying those high prices. And frankly, drug companies have admitted that they're still making a profit, even in those companies where they're charging lower prices. So I think there's a lot of work that needs to be done there to help make sure that U.S. citizens are getting the same kind of deals as other countries on these products.
Well, if I had to choose a team to be on, and I'd certainly choose AARP because we fight to win, and particularly with you helping to lead this charge. We've got about a minute left. Folks who are feeling somewhat overwhelmed by their prescription drug prices, give them a tip.
Well, first of all, I keep going back to talk to your healthcare providers. The most important resource is really your healthcare provider, and they can help you identify other treatment options if you are having a hard time getting access to the drugs that you need. And if you're interested in walking through your coverage options, AARP actually has a lot of really helpful information available on its website at aarp.org/Medicare. And another really great option is your State Health Insurance Assistance Program, or SHIP, that has experts that can help you and provide objective, personalized help. Can't speak highly enough about them. So a lot of good options out there for people who are looking for more information about to look at their prescription drug costs and their coverage.
Thank you so much, Lee. And if you're listening and if you're watching this and you're interested in helping to lift your voice, give us a call also, or check our AARP site and join the volunteer base and make certain that we work to get those drug prices down. We need all the help we can get. Thank you so much for the work you do. And thank you for all of you who have watched this episode. Please share, talk to someone else about the lowering of prescription drug prices and make certain that they know their options. Thanks so much for watching Real Possibilities. So you're leaving your money to a loved one. Will that money be taxed? And if so, how so? Shannon, can you answer that for us?
Absolutely. It's a great question. And I think you got to start first by understanding the difference between estate taxes and income taxes. Estate taxes are not going to impact most people. Mm-hmm. So estate taxes are what is left if you have too much money. So that number today is about 13 million.
Too much money?
Yes.
Okay.
So a lot of our viewers aren't going to reach north of 13 million. Mm-hmm. But almost every viewer is going to have the problem of income taxes after they pass. A lot of it has to do with how much planning you did while you were alive. Mm-hmm. The more you tried to avoid income taxes by setting up money in a retirement plan through your employer, an IRA, all of those avoided income tax while you were alive, your heirs will not avoid income taxes when those assets pass onto them. Mm-hmm. So understanding the difference between the estate and whether or not it's taxable and the asset that you pass on to somebody if it's taxable for income tax reasons.
So at some point, the government's going to get their money, whether they've gotten it through earlier or they get it later, they're going to get their money.
Unless you pass those assets on to a nonprofit or a charitable organization, mm-hmm. 100% they're going to be taxed.
And if you are a certain age, so say I think over 72, and you've already paid taxes on the money's in an estate, then it's not taxed.
Yeah, a lot of it depends on, did you take it out of the asset? And that's the big difference for people. I think you're referring to what are called required minimum distributions. Yes. At a certain age, and those ages have changed recently with some tax laws. Mm-hmm. But ultimately, if you take the money from a retirement plan, you pay taxes during your lifetime, then potentially they are passed tax-free to your heirs.
Folks, call your financial advisor. You need to make certain you plan. Thank you so much, Shannon. I appreciate you being here.
Yeah, absolutely.
CATA's regional mobility solutions can help seniors seize the day. Hear what riders and community leaders have to say about the value CATA brings to the lives of aging adults.
My name is Barbara J. Robertson. I've been riding CATA ever since 1988. Basically, it's for going to the doctors and the grocery store, and if I have to go to places or church or something like that. Usually, I try to come on first Sunday because that's communion on first Sunday, and I ride Spectran to come here for that. I take it with my goddaughter, so me and her boyfriend, we ride to Walmart together, or we go to Meyer in East Lansing when she goes to the doctors and stuff like that. And I have other people, I have friends in the building that takes CATA. I'm glad they got Spectran because a lot of people don't drive. They can't drive like me. Spectran is the only way I can get around, basically. I have friends and family that do have cars, but I depend on more on CATA. I know a lot of Spectran drivers. They've been knowing me for years, and I mean, I love it. This young man here, he was really patient, really nice, and everything. Yeah, it would be very, very frustrating without CATA, because, I mean, if we didn't have CATA, you know, the people that needs CATA, they would be in really bad shape because it's, you know, how can we get around without CATA? It's really helpful to the community. It helps the elderly. It helps the handicapped people and the blind people, disabled. So it's really helpful because it helps me, and I'm disabled myself. It's very convenient. If you don't have a ride, call CATA.
If there was no CATA, we would have a very big problem because we both have physical disabilities, so we can't walk like really long distances.
If we didn't have CATA, I don't know what we would do.
I'm Tracy Anderson from Michigan State University's Impart Alliance. Today I'm joined by Bethany Dizer, Assistant Director of Impart Alliance. Bethany also oversees our training program. Bethany, tell me what kind of careers you can pursue as a direct care worker, even if that's just where you start.
Yeah, direct care work is an exciting profession, and it is a healthcare profession just like any other. Direct care work is often perceived as entry level and that there's nowhere to go from there. But I work with so many direct care workers who have years of experience, plenty of training, and they go on to leadership roles as direct care workers, as managers, administrators. Many of them go on to open their own business. A lot of direct care workers open agencies or residential settings where they can lead a group of their own employees. And then a lot of direct care workers, it's also their first healthcare professional job, and then they get a look around and fall in love with another healthcare profession. I know so many nurses, that's my background, so I know a lot of nurses, but I know a lot of them who started out as direct care workers, but also physical therapists, physicians, social workers, special education teachers. There are so many great jobs that people have, and they started out as a direct care worker. And I also know a lot of direct care workers who have gone on to have satisfying, rewarding, long careers in this role. So all you need to do is access the right kind of training and education, getting started, getting to know who you are, what you have to offer, and the people that you can serve.
So many pathways for direct care workers, starting with direct care.
Yeah.
Should you put your children on your trust, on your bank account, on a will, on a deed? Let's ask David.
So what you're talking about, the way most estate planning is done, is what we call blunt force planning.
That doesn't sound good.
No, well, sometimes it works.
Yes.
It's not like it never works, but nobody brags about the time when it blows up in your face and leads to disaster. So that's the cases that I see, right? But if you did it, and this is how we do it, we think about what are the likely things to happen. When you put your kid on the insurance policy, on the IRA, on the bank account, oh, I avoided probate. Yeah, congratulations. But now your kid is going through a divorce, or they were in a car accident, or they have student loan debt that they co-signed for your grandkids to go to college, right? There's all kinds of ways, especially in this world, where people wind up with liabilities. And if you just blunt force deliver the money to them when you die, there goes the money. Instead of the inheritance being a nest egg, instead of the inheritance being a stepping stone to the future, right? It just goes to pay off the past mistakes. And you have all the power when you are making your estate plan to be thoughtful, to be considerate, to be appreciative of the world the way it is. If I asked you, has your life been a straight line since high school?
Absolutely not.
Whose is?
Yeah.
Nobody's like that, right? Things happen. But when you do blunt force planning, which is what is very easy to understand, it's what most people are doing. When you do blunt force planning, what you're telling me is every day's a sunny day. Nothing will ever go wrong. My kids are perfect.
And that's just not true. Thank you for that, David. I appreciate it.
Thank you, Paul.
Blunt force planning.
Blunt force. You don't want to do that.
All right. Thank you for watching Real Possibilities. There was such great information shared today. Please share it with your neighbor, your friends, your synagogue, your church. Let people know that we're working on their behalf to lower prescription drug prices and also on behalf of all those 50 and older. Thanks for watching Real Possibilities.